Welcome to Fandom
and Wellness,
a podcast about the complex relationship between fandom and mental health.
Disclaimer, we are not psychiatrists or psychologists. We are just fangirls with a vested interest in mental health.
Once again, please be advised that we may discuss the topics of sexual assault, domestic abuse, and post-traumatic stress disorder.
I'm Arkeida.
I'm Jenny.
And I'm Danielle. Today we're discussing the Unbreakable split glass universe with Andrea Letamendi.
Hi.
Hello.
Hi.
I know that you prefer to be called Drea, right?
I do. You can call me Drea.
Okay. We also like to ask our guests what their pronouns are. We all go by she, her, hers.
She, her, hers.
Great. So I met Drea when I lived in San Diego in 2009 at some little convention in a bar.
Okay.
I don't know.
Wait, you lived in San Diego?
For a year immediately after college, and she was wearing a really cute Darth Vader corset. And then I don't know. We were Facebook friends basically after that because I moved back to Brooklyn, and
well, you're skipping over the tattoo part.
Yeah. Oh, what? Just
the Harley tattoo.
Okay.
Yeah, well,
no,
do share because my memory is obviously blanking.
I think it was.
Is that why you came up to me?
Yeah, I think I was just like, I like your tattoo. It's a short bit. You have an amazing tattoo, and I think I just said I really like your tattoo, and then I probably ran away.
Yeah. So Arkeida and I talk a lot about our love of Harley, and you are also a Harley.
Yes.
Yeah. So then I basically known you more as an internet friend, I would say, as opposed to
internet friends are real friends.
Yeah, that is very true. You guys are more of my internet friends at this point because we live so far away. But basically, so Drea has a podcast called the Arkham Sessions, and that is kind of how I started listening to podcasts. It goes kind of episode by episode as if it's therapy sessions, talking about the different cast and villains in the show, and kind of diagnosing them, I would say.
Yeah, we're actually.
It's so interesting. I know you just wrapped up the whole series, which is.
You read my mind. Yeah, we actually have about 130 episodes, and so we've deviated a little bit from the core focus of the show, which is, as Danielle's saying, we take each episode of Batman the Animated Series and we lift up the psychological science and mental health related themes, and then I talk about those concepts and themes and try to draw upon more real life aspects of it to just inform the public about these really important topics. And over the course of about 5 years, we've covered every single episode of the animated series, including The Adventures of Batman and Robin and the New Batman Adventures, which I think totals 109 episodes, something like that. And so our next episode is actually going to be kind of a wrap up, which will just summarize our findings and talk about our favorite characters, and of course give honor and tribute to our favorite characters, including Harley, and just kind of how they've evolved and developed over time.
Yeah, so I probably should have said this before, but Drea is an actual psychologist. You've been written into the DC universe as Barbara Gordon's therapist, which is so cool.
That's so cool. I'm also a fan of your podcast, by the way. I've tweeted you a couple of times.
Oh, thank you.
That was because Danielle is the one who actually put me onto it, and I started listening to it, and I was like, "Oh my god, I love this podcast!"
Oh, thank you so much. It's really fun, and then like you're doing, it also feels like this is a service to the public, that you're talking about topics that they're just difficult to talk about. It's hard to approach. People don't know where to go for these resources and for the real information, and so it feels like it just feels like what I'm supposed to be doing. I have a day job, but this podcast very much feels like my actual mission in life.
Yeah, and then you have a TED Talk, and you do a lot of panels at conventions in regards to mental health and bullying and the superhero world, how it relates to it. So
yeah,
I was like really excited when I guess I made a Facebook status saying I was going to go see Glass, and you commented on it. And I was like, basically with your opinion on whether or not you wanted to see it. And I was like, no, go see it. And then you're like, okay, I want to be on this episode. And I was very excited.
I can't wait to hear everyone's thoughts on this film. I have so many mixed feelings and thoughts.
Yeah.
Yeah. This was a new thing for me. Doing a lot of new things lately.
You're welcome.
Thank you so much for going with me, Jenny.
Yeah, they went together, which was super, super cute.
If you were here, we'd have all gone together.
I know,
yeah.
But it is how it is. That's life. And then, so we also, I mean, you kind of answered why you wanted to be on the episode or show in general, which we just like to ask our guests. We also like to give our guests a little bit of space to talk about their own mental health if you so choose to. If you do not want to, you don't have to feel obligated to. The three of us all suffer from anxiety and depression, and we're pretty blunt about it. Yeah. So if you feel like talking about anything, feel free. If not, don't worry.
Yeah. I mean, if it comes out naturally and if you want to do it, basically.
Yes.
Oh, it'll be obvious that I have many ailments.
Great. We're all in this together. Okay, do you guys want to start talking about the movies?
Yes.
Okay, great. So, let's start at the beginning with Unbreakable. Did anyone actually watch it when it came out?
I was like 8 years old.
I watched it. When did it come out exactly? Like
2000, I think.
Yeah.
Yeah, I don't know
Yeah,
that I
you're
watched
right.
it exactly when it came out, but I did watch it when I was like a young teenager.
Okay.
I did not. I watched it for the first time last month.
Yep. Same.
And it was different for me because I think I've seen a few M. Night Shyamalan movies, and I knew that there was going to be the whole plot twist at the end, and I wasn't expecting that plot twist. Also, a lot of his movies really freaked me out, so I've just usually steered away from them because my parents decided it would be a good idea to take me as a child to see that one where they kill all the people in the village. And after that, I was like, I'm good with movies from this guy. I don't ever want to do this. You guys have scarred me for life. I'm like 12 years old and I'm crying. So yeah, but I did enjoy Unbreakable, actually. I thought it was very well written and very well played out. And my love for Bruce Willis is unwavering.
I didn't know you were such a big fan of Bruce Willis.
I want his children. Not his children, because they have his genes His kids all look like him. That's all I have to say.
I'll be honest, I'm pretty sure he's shooting blanks right now. He's 63. 63.
I don't care. I still love that man.
Well, it's interesting to watch Unbreakable now when in the basically.
Sorry. Are you okay? Are you okay?
Yes, continue. Sorry.
It's
interesting. I love him.
It's interesting to watch Unbreakable now in the basically in the age of the best superhero movies we've seen so far. And obviously it's very different, which some people like. I thought it was just fine. What did you think, Drea?
I didn't see it until well after it came out. And then I have this thing where sometimes I see movies and then I've forgotten so much about them that when I see them again, it's like seeing them for the first time. So this is one of those movies where before seeing Glass, I rewatched it. But it felt like I was watching it for the first time.
Yeah, I forgot a lot of it.
Yeah, and I think it holds up well. I actually really enjoy it. I really love the aspect of kind of like this concept of post-traumatic growth and different trajectories based on childhood experiences, and how just how who will later be known as Glass or Mr. Glass, how he is experiencing these hardships as a child and how he kind of internalizes that as he grows older. And I think that part of the don't know, that part of the storytelling, that part of the character development was just incredibly compelling and actually quite realistic. Like maybe his actual disorder and what he ends up doing is kind of fantastical, but his actual story I found to be really compelling from a traumatic narrative.
Yeah, definitely. I know that a lot of people had a lot of issues with the movie because it's the disorder that he has is so rare, but they maybe didn't depict it
do
accurately.
Enough research, and I didn't know personally that it existed in this world, but then again, there's so many things that do exist that it didn't shock me, and I wish that, like, as I was watching it, I was like, wow, why don't more films show this aspect of life and humanity, because it exists, obviously. Like, this is the only film that I've seen that has it.
Right. In a villain, basically, though.
Yes, in a villain, that too. Like, the person with a disability is the villain, which I always question that now when I watch movies, and it's like, oh, you have a disability and you're evil?
Well,
yeah,
that seems to be the theme of this trilogy.
Yeah.
Yeah. So just because we haven't said it, I just want to make sure I'm pronouncing it. Osteogenesis imperfecta?
Right. Yes.
That's the correct.
That sounds correct.
Which is, according to the movie, essentially like a brittle bones disease.
Right.
Yeah, I basically I did like a little bit of research on it, and what I found interesting was an article that was written by someone who has the disease, and they were talking about like the coding behind it, and that Glass, who is evil, is the one who has the disability, and David, who is like pure and like the one saving everyone, is the one who like turns out to be super strong.
Right, and it's interesting to basically, it makes it sound like someone with that disability would not be able to integrate into normal society, which I'm sure isn't true.
No, yeah, and he kind of does touch upon that in the beginning of the movie, Samuel Jackson's character, about like how the evil or the evil characters or the villains are drawn differently than the heroes. True. And that's kind of how he's portrayed in the film as well. In addition to the disability.
Yeah, and then like his disability is like one of the reasons why he has such a huge obsession with comic books.
Yep.
I think I'm perseverating on the concept of him being evil, because he, of course, at the end of the movie it's discovered, we realize that he's responsible for these incredibly awful,
catastrophic events.
Yeah, these catastrophic events that he is essentially responsible for. And so then, yes, according to that definition, the murder of possibly thousands of people, like obviously that's evil. On the other hand, it's interesting how he justifies this, that if he were to engage in these actions, these really destructive, really antisocial actions, in order to create a superhero to be a counterpart to him, what part of what he's doing is actually helpful to society. And this isn't any way to justify what he's doing, but it's almost a way to understand that he seems like a character who identifies as the villain in the narrative that he's orchestrating, but feels as though his role is to bring out heroism, which isn't an evil thing.
Yeah, he definitely, I think at the end of Unbreakable, he seems to view himself as almost a hero.
Yes.
Right. And of course then we have to go into the definition of evil and whether in general humans are evil or if they are just
inherently neutral, or
not inherently anything, but just like a group of people with varying traits, some more beneficial to society and some less, you know what I mean?
I think I totally agree, and I think that in our society we seem to commingle the idea of evil with the idea of mental illness, and I think that's really not it's not helpful to my field or to society in general, but it also inflates things. It also really confuses. It gets things twisted, is what I say, because it can be really harmful to associate evil with mental illness. And that's the struggle, I think, overall, if I were to say like the one thing that bothered me with all these movies is that that's kind of what it does.
Yeah, definitely. I wanted to talk about something that was like kind of totally unrelated, but it was in Unbreakable, and it was just like kind of interesting to me because I think it has to do with mental health. His son, whose name I'm gonna Google for a hot second. His son Spencer. No, that's the Joseph. Well, the actor's name is Spencer Clark. The son's name is Joseph. Okay. I was like, let me Google. He is clearly feeling like out of his mind and like almost like he's being like gaslighted, like to the point where he pulls a gun on his father because he's so certain that he's a superhero. And like, you know, like after he saves that family, or well, the girls in the family, like David ends up telling him that like, yes, like you're right, like I am a superhero. Like what do you think that kid's life would have been like if he hadn't told him? Like how much damage would he have done if he hadn't told him? Like do you think it was the wrong thing for him to tell him, or the right thing? Or you're
talking about Glass and not Unbreakable.
No, right? I'm talking about in Unbreakable. In Unbreakable, his son pulls a gun on him.
Yes.
Because he's like, if I shoot you, you won't die. And David and the wife are both like, no, like he'll die. You need to put the gun down.
But also, at that point, did he know whether he really had superpowers? I felt like he was still uncertain himself.
Yeah, I thought he had only understood that he was just a very strong person by that point.
So, basically, if he had continued, once he knew that he had superpowers, it would have been, I guess, gaslighting if he had continued to ask him and lied to him, basically.
Well, because in most superhero stories, I feel like, you know, they don't tell their family.
Right.
Yeah, so it's kind of interesting that he did tell his kid. Which I think was the right thing to do, because I think his kid would have went out of his mind.
Yeah, the kid was definitely confused because at one point he had this conviction, and then in that scene, from the way I recall it, I almost called him Bruce Wayne. Bruce Willis.
Oh, God.
Bruce Willis's character is
my husband.
It's almost like your husband, the father of your children. It's almost as if he isn't sure himself. Like, I think in that moment, everyone's terrified, and I think we're supposed to be terrified as the audience because we're kind of in that uncertainty. We're in that gray zone of understanding that yes, he's superhuman, but how superhuman is he? Is this going to be fatal for him? So I like the tension that scene introduces to us, because it's very real. But really the victim here is that kid, which I think is something Danielle's getting at, which is like, this is really messing with his sense of reality and his sense of what his father is capable of or not capable of. And there's a bit of withholding, there's a bit of secrecy, there's this like, you know, luckily at the end of the movie it's reconciled and they share this moment together that addresses that they know, he knows that he is a superhuman or a hero. But yeah, I think that scene is potentially, you could characterize it as being pseudo traumatic for that kid.
Yeah, I think that would have given him like major trust issues if he had not told him.
But if he hadn't told him and he had grown up, isn't it also possible he would have thought that was just like a childhood, like just like how kids will think they will have superpowers because they watch Superman or something.
Or like your
it's
dad's
just
strong.
in their past.
Yeah.
Yeah, that they, when they grow up, they think, oh, that was just me being a kid.
Yeah. I don't know. I think it's a little bit more drastic because he actually pulled a loaded gun on his father. So I think it's like a little bit more extreme than just like a childhood memory about, oh, my dad was really strong. I think he might have been a superhero.
Remember that time I pulled a gun on you?
Like,
good times.
Almost killed him. It was okay though.
I will say that there was already that level of distrust within the family because for some time, the character of David was not present within the home between the mother and the son, and then he ended up coming back. So, like, I'm sure his son already had trust issues on whether or not his father was going to still be there with the family or not. Yeah. And I think that just kind of added or heightened to the situation.
I was really I rewatched it recently as well, and I forgot most of the movie, and I got so mad because at first I thought that Bruce Wayne's character was a big old cheat, and I was like, Bruce Wayne cheating on your wife?
That's what I thought.
Bruce Wayne, goddammit, Bruce Willis cheating on your wife. This is gonna happen the whole episode. Just get used to it, everybody.
Bruce Willis would never cheat on me, just so you know.
I know. I was like, okay, thanks. Thanks, Mr. Shyamalan, for trying to sabotage that thought about Bruce Willis. But, yeah. So, do we have any more thoughts on Unbreakable before moving on to Split?
Well, we didn't really talk about Mr. Glass's mother that much. Oh, yeah. She's not even in the series she's in the first one and then in the last one, and I'm sorry my voice is in and out today. But I don't know, I'm intrigued by the way she's portrayed because she's still very loving towards her son, but at the same time knows everything that he's capable of, which I just find that very. I mean, you don't know a mother's love until you are. I mean, I know my mother's love, but like, I guess I wouldn't understand what that meant unless I had a child. Sorry, I don't know where I was going with that, but I was just very confused with how that relationship continued.
I thought she was amazing. Like, even when, everything came out about everything he had done, I don't feel like she abandoned him.
No, she didn't. No. But some would probably.
Yeah.
Considering how many people he has killed.
Yeah. But so the reason why the mom was not in Split is because no one from Unbreakable was in Split until the very ending.
Until the very end.
Because holy shit, like no one knew that was a sequel to Unbreakable.
No.
I didn't even know Split existed as a movie until Glass was announced, and I was like, wait, this is the third in 3? Like, what is the second movie?
Yeah. And when you had us watch it and I was watching Split, I was like, I don't see any of the characters. Why am I watching this? This doesn't make sense.
Well, it's funny because, so my husband had seen Split in theaters, and it's a very different movie than Unbreakable. Like, yep. I would say it's more of like a horror movie almost.
The tone is very different from the scared.
And so he said that in the theater, at the very, very end, all of a sudden there was just like a very small section of people who were like, oh my god, like when they realized it was a sequel, because not that many people, I guess, had seen Unbreakable. They just thought that they were seeing a horror movie.
Right.
Which is, I think that's a pretty cool concept.
Yeah. With people in red capes dying. Sorry, I still can't get over that movie. I'm still very upset by my family for taking me to see that as a child.
The Village. You're talking about The Village, right?
Yeah.
I've never seen it. I'm too scared.
When did that come out? Yes, I saw that as a child and traumatized me.
Well, it's interesting because I hadn't seen Split when it was in theaters, but I do a presentation for students and for faculty at the university I work at on concepts of knowledge translation and pop culture, and how I use pop culture to inform and educate the public about the things that I study, like mental health and psychology. And I would use 2 examples around the idea of how, one thing I would say is like, why not use pop culture to talk about mental health? Because guess what? Mental health is already in pop culture. Like it's already being used in pop culture and we're already exposed to it. So why not harness that and like flip it around? And the two examples I would use, having not seen either movie, was Split. I would show like the poster of Split and it would be like really ominous and scary. And then I would show a poster of Unsane and I would say, has anyone seen Unsane?
No.
Nope.
No.
Didn't do too well, but it was basically a woman is hospitalized in a psychiatric unit and feels like she's being persecuted. And I think, I haven't seen it, but I think throughout the whole movie, she feels that she's being kind of chased after her stalker. But the trailers for both movies really demonstrate individuals with mental health illnesses or challenges as people who are either the villains or are persecuting others. And so I would kind of give these two examples as movies that I don't think this is a real term, but I would say like this is the horrification of mental health. Like this is unfortunately a negative thing for our field, because these movies will portray mental health treatment facilities, personnel, practitioners, and individuals with illnesses as being dangerous, hostile, violent killers, like that it would be basically the crux of this, the crux of each of the films that I gave examples for were about how people were terrorized by people with mental health problems. And so, funny thing is I hadn't ever seen Split, but I just threw that out there as an example until I finally saw Split.
And did you still stand by what you said before you watched it?
I still used that poster in my presentation, but I actually kind of felt a little bit better about the movie, learning that it is not in our world, that it is in this M. Night Shyamalan kind of like universe, this fictional universe that portrays DID as more of like a superhuman power versus a mental illness, which I know we'll get much more into with the examination of the film Glass, but I did feel a little bit more understanding of it through that lens.
Right, because it was a very fantastical kind of premise that you can basically gain superpowers if you believe in it enough.
Yeah. Like I almost feel like the Beast came out because Dr. Fletcher was so insistent that he wasn't real.
I also felt that way as well. So, Drea, can you explain to us a little bit about what DID is? I know that you talk about it frequently on Arkham Sessions, but for the rest of our listeners who don't know what it is, could you give us some insights?
For sure. So, DID stands for Dissociative Identity Disorder, which is considered a pretty rare condition. Really, we're looking at 0.1 to 1% of the population, and it's characterized by the presence of at least two or more distinct identities or personality states, sometimes called alters, that each recurrently take control of someone's behavior. One thing that I make clear is that in the majority of the presentation of DID, the person who has alters typically kind of oscillates or moves back and forth or among the different alters. You can't have more than one alter be present at the same time. And the alters could be presented as completely distinct, different individuals, much like the character in Split. So could be a child, could be a different gender, could be a different age, could be a completely different personality. And in the majority of cases, there are incidences of childhood abuse, in many cases, sexual abuse. And this is probably we talked about it on the show a few times because this is probably one of the most controversial diagnoses for a few reasons. One is that treatment hasn't really been identified. There isn't like a psychiatric medication or any kind of neurobiological, neurochemical treatment that has been shown to be effective for these symptoms. You can certainly take antidepressants and anxiolytics to like impact or lessen the symptoms of depression or suicidality or other kind of like after effects or common symptoms that are associated with it. But for the most part, there isn't really an effective treatment for it. And then second, there are just really kind of debatable presentations that it's very unclear whether individuals with this condition are kind of presenting themselves with these different alters for some other secondary gain, or because they're having actual like cognitive or memory disorders or memory problems that are better accountable for their symptoms. So on the show, I think we covered this in the Two-Face episode when we were talking about the character Two-Face from the animated series. We were kind of examining the likelihood that this fictional character had this diagnosis, and we were able to come up with 2 or 3 more reliable, more, we would say more like evidence-based diagnoses that could also account for his behavior.
Yeah, and then so like one of the things about Kevin's DID is that it seems as if he's able to choose which personality he is going to like inhabit him at that time period. Is there any truth to that, or do people with DID usually not have so much of a choice?
It's interesting because I think this might be in Glass as well, where there's almost like a description of almost like a council or room where they're all hanging out and one of them gets to be present. One of them sits in. Yeah, I saw that as more of a figurative kind of symbolic thing than an actual place in his mind where all the alters are interacting. But those descriptions, I think that's where the movie really takes a lot of kind of like creative liberty, because I think for individuals who present themselves with different alters, they have so much memory lapses and so much memory loss and difficulty, almost like episodes where they can't remember what's been happening over a period of hours or days. And so the last thing they'd remember, or the last thing they'd be able to experience, is alters interacting with each other. They're barely able to be present when a single individual of their alters is aware and cognizant and speaking for them. So I think that's mostly fictional. But again, because there are so few, so this is such a rare condition that you have within the rare condition, these cases where people are saying that this is their reality, that they're able to identify these really interesting idiosyncratic symptoms that one could say, well, that's just that person. That's not really characterized by this disorder.
And would you say that Kevin's dissociative DID is a result of his past trauma? Because when I was watching the movie and then when I was watching Glass, it shows on the train his father with a pamphlet for DID, so he must have already been experiencing this as a child. Do you think that it could have been heightened because he was left with an abusive parent?
Well, he was being abused probably a little bit by his mom already.
Yeah.
Yes, even with the father present.
Right. Sorry, Andrea, go ahead.
Yeah, I'm having a hard time remembering how old he was supposed to be when we get like this flashback to the father. And this is really pivotal, right?
10 and under. Yeah.
And so that's kind of weird though, because this kind of condition, when people are endorsing these symptoms, this isn't really diagnosed in childhood. typically the traumatic events are happening in childhood, which was very realistic when you think about this fictional character, Kevin, for sure. But it would be really rare to see a developing child already having alters. I mean, that is probably misdiagnosed, or people just think like, oh, he has these imaginary friends, or he's making things up, or he has like just a creative side to him. I don't think many parents would actually believe he has alters.
Yeah, the one alter who's one of the most prominent ones in the movie, I can't remember his name, but he's the one who has
either Dennis or Barry.
Dennis.
What?
I think
Dennis?
Is Dennis the one with the glasses?
Yeah, with OCD.
Yes.
Yeah.
I thought that he said that he like started developing the earliest out of all of them because he was protecting him from being abused.
Oh. I thought, well, either him or the kid personality.
Hedwig?
Right? Hedwig, yeah. Because he probably stayed at the age that he was abused at or whatever to, like, have another personality to, I don't know, handle the trauma.
It's definitely probably not a fully researched portrayal.
Yeah. I mean, I think you're right.
I think he did. I did read an article that Shyamalan did do some research, but I'm sure he took some liberties.
Does he always? Because
I'm sure he took some liberties.
Do we all remember Avatar?
That's not. Oh,
that wasn't that great. Does he always?
He took a few more liberties with Avatar.
Okay,
but that's a different thing. Yeah, but also him opening a pamphlet for DID is also just a way to identify that guy as his father,
right.
in that scene. Yeah.
I've seen some people say online that was him saying that the father also had DID, which wasn't
like
that's not how I read it.
No.
Wow.
I thought that Glass said, I mean, we're skipping ahead to Glass, but whatever. I thought that he said his father was going to try to find him help.
Yeah, that's what I got from it, was that he was looking for help for his son.
Yeah, so those people on the internet are wrong, so.
Yeah, that's fair. People on the internet are often and usually wrong. Yeah.
Do you guys want to talk about Casey at all?
Yeah.
Definitely.
Because I was personally more interested in her story than his.
I was very interested in her story in both Split and Glass, because I felt her in high school, I could relate to her and why she always wanted to be in detention just to get away from everything, but also I don't even know how to describe it in her capturing, but it was almost pessimistic in a way in her with the other girls and how would you say it's pessimistic
or realistic?
You're right. I don't know. It's somewhere in between the two, because I don't know. I would say it's a possibility that they could have worked together and overpowered him, but what's the reality of them being able to get out? Because it seemed like that building was so massive and almost maze-like.
Yeah, she
locked up.
She was very clearly using coping mechanisms that she had learned through years of sexual abuse from her uncle. It was, I don't know, I don't want to say funny. I don't know what word to use. But my husband and I watched the movie together, and as soon as she was like, pee on yourself, when he was taking the one girl into the other room, I was like, oh, she's been raped before. And he was like, how have you guessed that? Because he had seen it. He'd seen the movie before. And I was like, because, I don't know, I'm a woman, and like, we're told these things that like, if a stranger is going to rape you, like, pee on yourself. And like, that's not something that I have done, but I do have a friend who was attacked by a stranger in the street, and she defecated on herself, and it made them stop. And like it's just like women are just like taught these like
you're taught these things,
horrendous like coping mechanisms to get sexual abuse to stop.
I think that for the I would say that split of these three, for folks listening who either haven't seen them or who are just kind of like reprocessing this, Split has sort of like continuous moments that are just very intense, and I would even say like could be triggering for people, like from the moment that the girls are initially kidnapped, the way that they're kidnapped, the way that they're attacked, and the way that I'm forgetting his like main name. I don't know what he goes by. Kevin. So he's able to kidnap them, and then they're passed out for periods of time, so they have these lapses in consciousness, and then the way that the girls respond to the entrapment, to the just kind of the physical assaults, to the way that he interacts with them, like they're of course presenting, they're just like trying to survive, and they're using what they know to get out of those situations. But it certainly is those parts of the movie, I just felt like I don't really want to be a part of this. Like, I don't want to watch this. This is really intense, and this is like, where is this all going? Why does this have to happen? And I think that for us to then begin to follow Casey's story gives it a little bit more meaning, and then kind of allows us to find some narrative that we could really, might ground us, or might make us feel like, okay, there's some hope here. There's some kind of like, maybe there will be revenge, or maybe there will be some kind of survival story that helps us get through this. But I did struggle a lot with kind of the first part of this movie that was mostly about victimization and entrapment, and kind of the girls really suffering, and I didn't really like that.
Yeah, I had a really hard time with the movie. Like I cried a lot, like the rest of the night, and I couldn't work probably for the whole next day. Like it was very hard on me. And just like at first I was like, are they using Casey's character and backstory as just like a plot device, like as often the rape is used in movies and stories, or like women's deaths are used in stories, and this is like one of the rare situations where like I understand why it actually was important, like it actually did build the story, because it made him be able to relate to her, because he was also like abused.
Yeah, I mean, it informed us on why she made the decisions that she made.
Yes.
Right, for one. And this kind of like victimization and focus on that is common in horror stories, I think. Right? Because that's the point. These victims go through pretty much the worst things that can happen to them, and usually they get out okay. They survive, or some of them do.
I really hate that trope.
Yeah,
so I'm not surprised by it, because it is a horror film, but I do. I was invested in Casey's character and her story.
Yeah, and it's interesting to be like, okay, well, these girls who have not been through the same things as she has thinks that they know what's best in the situation, but in actuality, like, she does, because she's been through something maybe not quite as heinous, but still pretty damn heinous.
I kind of wish that she had saved herself, and not that the beast has stopped just because she was a victim too.
Okay, yeah.
You know, I would have preferred if she saved herself.
Yeah.
Yeah.
Yeah. I mean, do we like that whole like the broken are the more evolved narrative?
It's very interesting. Yeah.
Yeah.
It's an interesting sentence.
Yeah, I mean, it's like it's kind of like what doesn't kill you makes you stronger, and like
right, exactly,
and like you go through abuse for a reason type of thing.
I've never. I feel like.
I don't mean that's true. I'm just saying.
No,
like,
I'm not saying that it is or isn't
yeah.
true, but I think it was like last year or a year before I had seen a meme and it said, "What doesn't kill you makes you stronger," and they had crossed out "stronger" and it's like gives you more anxiety and depression and PTSD. And I was like, "That's correct. That's true. I don't feel stronger at all." I was like, "Yeah, I can get with that," because it's like I have been dealing with my PTSD for a little over 2 years now, and I don't feel any stronger from it. I don't feel any more comfortable going outside. I still do it because I have to, but I don't feel any. And for those who don't know, I was hit by a bomb in a terrorist accident in New York City, and I still don't feel comfortable going outside. I still don't feel safe outside. I still don't feel safe inside of my own home even. So like the whole "what doesn't kill you makes you stronger" thing, maybe it works for some people, but from my experience, I think it just makes you better able to survive. I don't think that correlates necessarily with being stronger.
Yeah.
And yeah, I think it depends on whether you read this as trying to be an accurate depiction of abuse or whether it's trying to be inspirational, I guess. Mm-hmm. like you've gone through this and you can become stronger as a result or whatever. I don't know.
I kind of I was almost there with it, but I mean, Arkeida, I agree with you, and I think it can be a really troubling message to say, no, the more that you survive, the more trauma you experience, the stronger you are. I mean, scientifically, that's actually not true. We do have a tipping point. We as humans have the ability to be resilient and in many ways should be stressed and should experience coping over time in an intermittent way. But intense traumatic experiences, like the one you had where your life, your livelihood, your personhood is threatened, that shouldn't be something that doesn't necessarily make us stronger. It readies us for that kind of environment. And when you talk to veterans and service members, they are many of them will say, like, I'm more prepped, I'm ready, I'm well equipped for a combat environment because of the kinds of things I've been exposed to. But it doesn't make sense. It's really not adaptive when I've integrated back into society, into kind of like, the non-military society. And so there is a little bit of truth to the idea that adversity can really equip us with important stress responses that are more adaptive and that are better for us. But I don't know, the way that it was presented in the film, I think I was like having a brain twist. Like I was just like, I really want this to work. I really want this idea to work for me because I love the concept of post-traumatic growth, that we can become better selves and rise above and overcome hardship, and even acknowledge that, like, yes, something happened to me, but I am not defined by that thing. I am not my trauma. But I don't know, the end of that film, the end of Split, was difficult for me because it seemed like the story wanted to empower Casey and have her acknowledge that she has a traumatic past and that her personhood is really related. Her power, her sense of strength is related to that, but she still was under this person's control. I agree that if she had been more active to, I don't know. And it's hard for me to even say that if she would have done something different or been more active. Like now I'm even, I'm insensitive to the victimization that she experienced and not addressing her character as a survivor. So I'm almost unsure if there really is a right way to present this ending. And if anything, I think the ending is supposed to give us have us sympathize with Kevin, or have us relate to, or be like, oh my gosh, he like, we understand him better. He's no longer a monster. He's this other persona.
Yeah, I think it was like his last ditch effort to be like, no, he's not totally a villain. I'm not totally demonizing DID.
Right.
Look, he spares some people. But it's also kind of making him the decider of who has gone through trauma.
Yes, that's another thing.
Like, how does he know what these other two girls? I'm just using the three girls in the majority of the story as talking point. But how does he know what the other two girls have gone through? Like,
he just said that he's followed them.
He's been following them for months.
Okay, has he been following them for their entire life?
No.
Has he been in their heads their entire life? Has he been on their computers? Has he been everywhere? Like, I don't know. Like, everyone's trauma and how it affects them is different.
Yeah, he only registers visual trauma because he doesn't know what's happened to Casey until he sees the scars, right?
Yeah.
Yeah.
Sorry, you guys, I got a little emotional. I don't talk about that stuff very often.
It's heavy stuff.
Yeah, I think I appreciate that you brought it up and that you shared that, because I think it's important to, as we're talking about, like, obviously those are fictional characters, but many of us have experiences that we're dealing with and will likely deal with for maybe the rest of our lives. And so here's this like interesting story. The one thing I would say is it allows us to bring up, and this is what I was talking about with knowledge translation, that this film is allowing us to kind of address the concepts of post-traumatic growth and, of course, post-traumatic stress responses like PTSD, and how that's a very real experience, and how many people might be seeing a film like this and are reminded of the ways that they're dealing with their PTSD.
Mm-hmm.
Yeah. Like, I mean, like, so like when he said that to her, like, my gut instinct was like, wow, like, he really sees her, like, and it made me feel like oh, like someone could like understand me and what I've gone through, and like would sympathize, and like, because like a lot of the movie, like she obviously feels too embarrassed to talk about what has been happening to her with her uncle and like being raped, and it's just like, but like moments earlier, she saw him literally like eat her friend. Well, not friend, but whatever. Classmate.
That was very difficult to watch. That was
unexpected.
But like I mean, like, I don't know. It was a big mind fuck, which I know all of his movies are. But
yeah, totally.
And she showed empathy towards him, like, even while he was like being an aggressor towards her. Like, she did try to like get Kevin back to reality by calling his name.
Yeah.
And then he said like, oh, like, to kill him.
I was gonna say I saw that more as like a survival tactic for her as opposed to like empathizing, but that was just my point of view of it.
I think that it was a survival tactic, but I think the fact that she waited so long to get that gun was her showing a little bit too much empathy in that moment for him.
Right.
Like, she could have gotten that gun and killed him while he was still Kevin before he turned back to different...
Yes. No,
to Dennis or whichever one he turned into after that.
I think just kind of echoing Danielle's point about, like, we might be able to find some elements of interpersonal connectedness, like, but I think this is supposed to tell us something about Casey and Kevin. Kevin's prime, right? Is it Kevin? I don't know why I keep forgetting his name.
He has a lot of alters.
Yeah, with Casey and Kevin, maybe there's some kind of lesson there about, like you're saying, seeing people for who they are and really having, I don't know, that sense of acknowledgement, that sense of validation, that like, not only is it okay that you've experienced trauma, that you've been victimized, not only is it okay, but actually I see you as superior. I see you as better than everyone else. But then as we unpack that, I don't like what that's actually saying. I like that she's visible. I like that she sort of becomes heroic herself. But I think at the end of the day, the problem still is present for me, that a person with these presenting symptoms, a person who ostensibly has a mental health condition, is like going around capturing girls and eating them. And I can't, like, that's not okay.
Yep.
And it's
that's a controversial thing you just said, but I agree.
Is illegal.
Yes,
it's kidnapping, but like it's all illegal.
It's and again, if this were presented as like, I don't know how it could be presented differently, as a drama or something, but this is presented as a horror film, that we're meant to be terrified by this individual, this man. We're meant to be horrified by his actions. We're meant to be scared of him. And so again, we walk away. Yes, we understand this is a fictional universe, but we walk away feeling like, okay, so people who have, people who are not neurotypical, people who don't have more common mental health presentations are dangerous or might eat people. And that's not cool. That's not a cool message for me.
No.
No, it's not.
I just want to say that's not a thing. People with the idea are not going to eat you.
No.
Right.
Only people from Florida.
Oh, God.
I'm sorry.
Disclaimer, not everyone from Florida will eat you.
Okay, so do we have any final thoughts on Split before moving on to Glass?
Yeah, I wanted to say what my favorite line in that movie was.
Okay.
Yeah.
What's the older female character alter that Kevin has? What's her name?
Patricia.
I think at one point she says, Asian people's music aids digestion.
What?
And I was
my
like,
God.
That's interesting, huh?
Wait.
Wait.
Now I want, like, which Asian? Because there's several. Like, which Asian?
For that lady, I don't think it matters.
Yeah.
I'm like, okay, I guess I'll test that.
Jenny.
Anyway, anyone else?
I'm so confused by those statements. Oh,
I looked it up. It's not a thing.
You looked it up.
Just in case.
Leave that.
There's all different types of studies out there, man.
Yeah, there is. There definitely is. Oh my God.
Anything else?
No. I think let's move on to
Glass. Okay.
Yeah. So did we have any thoughts about Glass? I feel like we've all shared thoughts about
I feel like we might as well just start back with Casey and Kevin because we were already talking about them. And so so I might as well start with like Casey, like going back to comfort Kevin and like showing empathy towards him.
Yeah, because at the beginning of the movie we see that David rescues those 3 or 4 girls from that warehouse, and that Kevin is finally captured, but Casey goes back. Like, is there any semblance of a reason as to why she could possibly go back? I know
like, is this like Stockholm syndrome, or is it just because she like feels so connected to his character?
I was hoping that something would be revealed about her, that she had been hiding superpowers, or that she was discovering some kind of power, and her relationship to Kevin was leading her toward accepting that.
Yeah, I also thought she was going to have a superpower. But...
Right? And then that didn't happen. So it's somewhat inexplicable, but I think you have a good point about potentially this being the only person, and this is, maybe we can think about this as very common for survivors, that this is somebody who has shown some like strange affection for her, shown attention toward her, potentially even showed understanding of her. And so she might feel compelled. She's drawn to this person.
And helped her realize to report her uncle.
Yeah. Yeah. So we might see this as some kind of development from her side. And I think I'm still wrestling with the fact that he is still, it's almost as if the actual villain is the beast alter, and that the other characters within this single body, the older woman, the younger kid, who is actually quite entertaining and almost adorable with the etc. stuff.
Oh, I didn't realize he was saying that until I was like, is he really saying etc.?
Well, I think that it's supposed to be that Patricia and the Beast are essentially villains.
So if I see it that way, I almost feel better about the story and about Casey's relationship with Kevin. Like potentially, if these multiple alters are, if there's some kind of analog to all of us have a part of ourselves that are destructive, some part that we are impulsive around, we can't control it, we dislike that part of ourselves, but whatever beast is in all of us, like how do we, maybe we're loved despite having that aspect of ourselves. So I think there's maybe some, again, I'm kind of like trying to figure out how this could be relatable and justifiable. Just the fact that Casey is connected with him and potentially like loves him. I don't think it's because of what he's done. I don't think it's because of the beast. I think it's because who she thinks he is without the beast.
I was just thinking that it feels like she basically sees them as completely different people in the same body. So she's connected to Hedwig and to Kevin, for example, but no one else, really.
Yeah, and I think that she probably does think that the Beast is like a superhuman.
What about your overall thoughts about the movie?
About Glass?
Yeah.
Oh, God.
Heavy sigh.
Oh, dear. It's really the big, I don't know, the surprise is that the therapist is not a therapist. She's this agent in this covert organization that is, I guess it's still mysterious, but my understanding is that they're supposed to be eliminating these potential superheroes that are among us all. And so I felt, of course, I felt that the guise of, the identity as a therapist, it is a setback for the field of psychology. That like, why would, like, again, somebody who's deceptive, somebody who's persecutory, somebody who's the villain is actually presenting themselves as a psychotherapist, and not just that, like a high level expert person you can trust. And then it turns out that she's the bad person in this movie. So obviously, even though she wasn't a real psychologist in the end, I just kind of felt annoyed with that.
Yeah, it's so funny because like for me that wasn't the twist, because I immediately was like, oh, she's not really a therapist or a psychotherapist.
Where do you get these ideas from?
I'm really good at guessing movies and shows. It is extremely hard to surprise me. Watching things with my husband, he's always like, because I guess things like instantly, and he's like, what? And then like an hour later, he's like, holy shit. Anyway, but because she was so bad at it, she was like gaslighting them the whole time. And like, I'm like, I just don't think a therapist would act like this. So I just was like, I don't think that she's a real therapist. Like, to me, I mean, I want to go back to that, but to me, the twist was that Glass essentially like planned for Kevin's dad to be on that same train as David's, and then he like turned into the Beast 17 or 20 years later or whatever it was.
But did he know that he was?
I didn't know that was the. I didn't take it as that. I thought that was one coincidence of it. But I thought
coincidence. Okay, to me, it seemed like it was planned, and I was holding my mouth in the theater because I was screaming because I was like. What? Because I thought that's what the twist was, and I was like, I could not have possibly guessed.
Unless he has a superpower of telling the future, I'm not sure if he would have been able to plan that far ahead.
Because I think he said it just took him longer to create the beast. So I think the beast was the coincidence.
Okay, I'm sorry. I misinterpreted that.
You could totally
as like because he said it took longer. I just thought that he meant like he planned that all along.
I was in and out of confusion with this. I'm confused all the time. But
okay, fine.
I feel like you left your body.
I just wanted to be surprised for once, okay? So I just wanted to be surprised for once. So I thought I was surprised for once, and I was happy.
I mean, you can interpret it however you want. We interpreted it as it was just a coincidence. Yeah.
I do agree that that Mr. Glass feels that he created him, that he's his creator. I do think he feels responsible for that. I don't know if I think that he probably wanted this train wreck to be the catalyst for a number of things, and so did he actually formulate, like, did he think he was creating these alters in this child? Like, no, I don't know that he was planning it that far ahead, but I do think he feels responsible. But the other thing, but I have real problems with this because with I don't know, the initial twist or one of the twists is that was that wing of that hospital or that center were all of the employees and all the practitioners, all the techs, like all the staff, were they in on it? And if they weren't, so they were just kind of like maltreating these patients because then they thought, so they actually thought they were patients.
Yes, they were not in on it. They were mistreating the patients.
Yes.
So yeah, again, I don't like that.
Yeah. So
I feel like you see that a lot. The that mental health professionals and staff who work in mental health facilities
mistreat their patients.
Mistreat their patients.
Yeah. So do you believe that's realistic? I mean,
no.
You're probably the most experienced being around that.
No. I think it's problematic for our media because when you portray such abusive and heartless systems, facilities, staffing, treatment, types of treatment, then you really you further stigmatize mental health experiences, disorders, and then you also I say it's a setback for the discipline and for the field because you're not encouraging people to seek help. It actually discourages people from reaching out and trying to seek help because if they see these kinds of portrayals, I think most people can understand that it's fictional, but is it based off of some foundation? And we're only human, so I think that the more we are exposed to those kinds of perspectives, the more that we'll get the bias that, well, if I'm ever in a facility like this, should I just expect to be maltreated and abused? And of course, you shouldn't be. This is like incredibly false. This isn't what treatment facilities look like.
Yeah, I mean, so like that's one of the reasons why it was obvious to me that Dr. Staple was not a real psychotherapist because like I haven't been to therapy like that, obviously, but I've been to therapy and like it's just therapists are not like that.
There are some bad therapists out there though.
Sure, yes, okay, that is true. There are some bad therapists out there, and if you don't like your therapist, please try a different one because it should be a relationship that works for you. But I think that is like a big misconception of what therapy is like, and like a fear of what therapy is like for a lot of people.
Right. So like they use like light flashes to change the alters for Kevin. Is that based on any reality at all? No, right?
No.
Drea is like shaking her head in like such disapproval right now.
There was a lot of methods within that film that I was wondering. I was like, this can't be accurate because so much of it was detrimental to the actual people that were helping. And then, yes, at the end when it came out that she wasn't a therapist, I'm like, okay, that explains why. But like,
yeah, the room that Bruce Willis was in was gonna flood with water.
Yeah. Oh my God.
What? That's clearly.
So,
these are not real methods. These are I mean, I would say that these are abusive methods.
Yeah, so like, is that some like whacked out take on like immersion therapy or like?
I think
I don't even think that's immersion therapy.
No, they're trying to deter him because I think that they're with him. Are they trying to? I think they're trying to access information from him. I can't remember. I know that like that this is meant to deter him.
I saw it as several things. So for him, his strength is essentially he's very strong. He's unbreakable, indestructible. So he could use his strength to break out, and that was supposed to subdue him. In addition to that, I saw it as him having a fear of water and them using that in a way against him to like bring up those past traumas in his life of being almost drowned.
Which is terrible. And also, if they're trying to convince him that he's not strong, then shouldn't a normal door, like metal door, prevent him from escaping rather than water? You know,
that didn't make any sense. But I do think no. I think then the moment that the so-called therapist has the three patients sitting together, where she's kind of like supposed to interrogate them or just call them out on their deception of her or in their unwillingness to embrace their heroism, whatever she thinks she's doing there. I thought that was also like, I almost walked out because I'm just like, you would never do something like this, and you would never put them together this way.
Yeah, like group therapy is a thing, but not if all three people are there because they are like
tried to kill each other.
And she has 3 days to convince them that they don't have superpowers.
Yeah,
you can't do anything in 3 days.
Right.
No, and I saw that as like when you are in a mental institution, like the 72-hour period. I thought that's what that was, but this isn't quite the same thing as like being diagnosed with depression or anything. Like this is a whole different ball game. So I was very confused. I was like, you can't convince somebody that they aren't a superhero in 3 days, especially or that they don't have this disorder or that they don't experience this when they've been experiencing it their entire lives. And by this point, they're all old. Like Mr. Glass has been living this life for some decades now. Same with Bruce Willis.
Are you upset about calling him old? You look.
He's 63. Okay. I still love that man. And same with Kevin's character. Like, they've all been experiencing this for several years. So there's no way that you can undo all of that in 3 days.
Yeah. I was like, you know what? Therapy takes years.
Mm-hmm.
There's no way this person's a therapist. 3 days. 3 days.
She should know better.
Well, maybe that was her way, kind of going back to what her objective was. This could have been some way to gaslight them or to convince them that they have mental illnesses and not have superhuman powers. And so I'm guessing that her methods are meant to kind of like strip them of their humanity and just make them feel worn and torn out and just like, okay, fine, give in to the expert who's saying that actually what they're experiencing is a neurobiological affliction and not some kind of supernatural experience.
Would you as a psychologist ever I mean, sorry to ask you.
Probably no. None of these things are things I would do.
Like that.
Nothing that happened in this film.
Wait, okay, would a reasonable psychologist ever gaslight a patient, even if they have like grandiose, like thinking like that?
Not in the way that gaslighting is typically done. I mean, I think that, I won't speak for other people, but I think something that's one principle or value that is honoring the practice is to really validate someone's experience and to understand that even though if I don't have a full grasp of what their experience is, I at least let them know that I understand from a perspective of an outsider, from a perspective of listening to their accounts and their perceptions. So you will, we encounter people who have delusions or hallucinations, and we know that they have some disconnection to reality, and it wouldn't make sense for me to be like, yeah, this is all true. You're actually, the voices you're hearing are real, or the things that you're seeing, it really wouldn't make sense to validate the reality of that. But I think that it is still helpful to acknowledge that that's their experience, and to again, just kind of see them for who they are. And if they have such conviction and are really, really in that sense of dissociation or sense of this break from reality, that there is some value in giving them that sense of validation and that sense of that their perception has a validity to it. But apart from that, it doesn't really make a whole lot of sense to challenge people so much on the things that they're saying they're experiencing.
Yeah. This episode is obviously also a lesson in if your therapist is not doing what
Is gaslighting you? That's not good.
If your therapist is anything like the therapist in Glass, then just run for the door.
There are other therapists.
There are others out there that won't try to kill you.
Yeah,
because that's not what they do.
Yeah, she gets
Succeeds.
all three of them killed at the end of the movie.
Yeah.
That's the actual like goal of the movie. If she can't convince them that they're not superheroes,
Right.
I can't believe they did it. I can't believe they actually killed all three of them.
Yeah.
I didn't see that coming.
No,
Yeah.
I was not. I was hoping, that Bruce would survive. Sorry.
Drowned in a puddle of water.
Did in a pothole. I was so upset. I was like, "What the hell is this?"
Oh man.
And his son was there.
Yeah.
Oh man. Yeah.
So was Casey. She was there too, and Mr. Glass's
and the mother.
Everyone was there, and it was just so.
That
it was very jarring.
That mother, the most supportive mother in the world.
Really is.
Seriously.
Do you feel that the end of the movie with their like unveiling of what happened to the whole society, like, do you think that was rewarding at the end? Like, does it justify their deaths?
I posted on social media got viral tweeted.
Yeah,
I'm about to say.
Yeah, Jenny.
When is everyone gonna see it? Just wait for it.
And they all see it at the same time.
Yeah, you were in the theater, Jen. You're like, that's not how this works. And I was
for Shyamalan it does.
But back to what you were saying. It was in the end Glass 1, because he never really cares about his own well-being. He cares very much about exposing this specific idea that there are superheroes and people with superpowers out there. But it doesn't really help Bruce Willis and Kevin at all. Nothing. It doesn't benefit them because they died and that's it. Like, even the world knowing that superheroes exist, who cares for them? You know what I mean?
Yeah, it doesn't necessarily affect their day-to-day lives anymore.
Yeah, for Glass, like, it's not about them. And I guess
it's about proving his point.
And I guess like I could understand why for like Glass's mom why it would be satisfying, because like, all right, like my son died for something and he was right all along.
Right.
But for the other two, I don't really
why would they
know
care?
why it, yeah.
Right. Especially for Casey, who I was expecting, like, this is where we're going to learn that she has something special about her, that she also is a superhero in some way, and she's not. She just participates.
Maybe in the sequel.
Go viral. I really hope that this is. I hope this trilogy is done.
I'm also hoping that this is the end.
Yeah. I don't know how well it did, but review wise, it did not do well. That's all I know.
Yeah.
Did it?
I don't know how it did well money wise, but also if there's one thing I believe in, it's in humanity's ability to explain anything away, because people can see that and be like, "That's just CGI. That's just like an ad." You know what I mean? Like I don't quite believe that someone will see James McAvoy do his weird dog run and be like, "Yeah, that's a superhero right there." You know what I mean?
Wait, we would be like, what is that? What's happening?
It actually did pretty
well.
well.
But then
in the
we would never
office.
see anything about it again because he's dead, and we'd be like, okay, what's the next interesting thing?
Yeah.
Yeah. But so on Arkham Sessions, you basically like kind of diagnose the different characters. Do you feel like you have enough on Glass between Unbreakable and Glass to be able to diagnose him?
Yeah, I don't know that I certainly, I do think that because of his childhood experiences of living with a really rare condition and being so vulnerable as a child and not being able to connect with other kids in the way that he wants to, like always seeing himself as different, and then certainly like having potentially childhood traumatic experiences, I do think that if anything, he likely has, like, there's the aftermath of that likely impacts his mental health. And so would I necessarily say that it's a post-traumatic stress response? Would I say that it's related to his trauma? I don't really know. I think that this is above and beyond. This is kind of like what his actions are kind of separate to me than his traumatic experiences. But the way that, and I appreciate that you brought up the show, because in the beginning of our podcast, we really were centered around diagnoses and trying to give these categorically diagnose people or characters, and we really evolved past that. I think that's really important foundational information, but we moved past that to better understand, like, what are people's unmet needs, what are their motivations, and what are they driven by, to better understand their psychology. So I do think diagnoses are important to help us understand their motives, but I think for characters like, especially these characters, what might also be helpful is understanding their unmet needs related to their social and emotional growth. And so for Glass, it's clearly he was never able to connect with other human beings. And so he created a persona, a sense of meaning, a sense of purpose with his identity. And it really ended up kind of like fulfilling itself.
Yeah. Yeah, I know that on the show also you try not to diagnose based on one episode.
Yeah, true.
Which is why I was saying, like, because you got to see Glass essentially like 20 years apart from himself, which is kind of interesting.
Yeah.
In character development.
Yeah, and I think there's also something a little dangerous about associating diagnoses with specific actions, especially if they're kind of horrible.
Yeah.
Just like how, like, serial killers will have a specific history and a specific background, but not everyone with that background will become serial killers, you know?
Mm-hmm.
Right.
Yeah.
True. Yeah.
Yeah. And I didn't notice this personally, but apparently there are different colors associated with each character. I don't know if you noticed anything. Like purple. Well, purple I noticed was associated with Glass. He wore a lot of purple.
He looks so cool in that suit.
I just thought he was purple This could be me, but Samuel Jackson just likes color purple. Because even in Star Wars, it's like, you have this color saber, you have this color saber.
He just Samuel looks so Jackson, good in it.
Purple saber, and I'm like, really? You're the only one with the purple lightsaber. I think you just like the color purple.
Yeah, and like the Beast was yellow and David was green. Did you notice that at all?
Yeah. I mean, I thought that was really striking, personally, but...
Yeah, I thought that was... I noticed it. I think there was also... Maybe there were movie posters or something that also drew upon the color association. But it's interesting. I never got the sense... I don't know. I thought maybe those characters would be a collaborative team or some kind of like... There would be a bigger meaning. But I didn't really like that they're just... They didn't really... Aside from having the shared experience of being abused in that treatment center, they didn't really have this like sense of teaming that I thought was going to happen.
Yeah.
Yeah, I thought that there would have been some kind of a redemption arc for Kevin or the Beast at some point during this film. And then when the ending happened, I was like, oh, so this is where he just
I think like
bad.
I think his like quote-unquote redemption is just him, like, basically saying he doesn't want to be the Beast.
Yeah, I guess. And staying as Kevin until the end.
Yeah, like, is there any truth to that method? Like, calling forth someone's original name and, like, getting that altar out?
No fucking way!
Where do you think he got these, like,
far-fetched?
Those are the fantastical aspects of these films, yeah.
But I will say, Jenny, just to bring it all back to the color aspect of it, because I do love color, and it's something that I do want to continue studying if I ever decide to get a master's degree, is that when you look at a lot of superhero action films, a lot of their promotional posters, when I saw that question, I was like, oh my gosh, yes, this is just what I want. When you look at it, you see a lot of superhero action films. The colors are always these primary colors or secondary colors to determine the good person. So the good person is always blue or yellow or orange. And like, if you look at it and also red. So like Iron Man, red, Captain America, blue. Even like Transformers films, it's blue and orange, and it plays along those primary good colors along with their complementary colors. And then when you look towards evil, it's like it's different. It's something I've been trying to study more, and I've been reading up on Joseph Albers, and he's like a color theorist and how.
Well, what colors are usually associated with evil, other than like black, maybe?
More blacks, darker tones. Definitely, I would say green, which was odd because in this, green is David, which he's supposed to be the reluctant hero, but in other, it's
so Shyamalan did not study color theory.
He obviously does not know who Joseph Albers is.
I mean, he had tweeted why he used the colors.
He did?
Yeah, so basically, I'm just going to read his tweets.
Okay.
That's some research. Anyway, so he chose green for David because psychologically it's associated with life-giving properties, and David is the protector of life.
Yeah.
Does that sound...
Like green plants, yeah.
Sure.
Okay.
He chose mustard for the Beast because this color is associated with religious ceremonies, Hindu and Buddhist. A monk's robe. I see the Beast as an evangelist, a preacher who wants to help save the broken.
I guess that is the vibe that he was going for.
Yeah. And finally, I chose purple for Mr. Glass because this color has been associated with royalty, majestic qualities. Elijah sees himself as important. A main character of comics.
Samuel L. Jackson just likes purple.
And
he likes the color purple.
So,
okay.
What do you guys think of this series as a superhero trilogy in general?
I mean, as problematic as it is, I still enjoy it. And I just think it's like... I just think it's fun to every so often get a break from blatantly obvious superhero movie.
Yeah. I think I liked it.
Yeah.
I would probably not watch Split again for the sake of eating people and everything that came along with that film.
Also,
but I did.
It is funny that I say that because the comic books I read are almost strictly like capes and tights comic books.
Yeah. But I enjoyed it. I enjoyed it a lot in terms of, because this is me watching it for the first time this year in its entirety within the last month and a half, knowing that I've watched all of the MCU and DCU films, and I see this and I'm like, oh my god, what if we introduced this like concept to like Captain America or like the Joker, and how would they react to this sort of thing? That was my taking from it. But at the same time, I'm like, this kind of therapy does not exist. So don't do this to anybody, please.
What do you think, Drea?
I do think that there's a place for this kind of superhero narrative, and I really love the idea of subverting the typical superhero story. I just like, I have a hard time with the mechanisms by which to tell the story, the treatment centers and the patients being lied to, and just kind of like really the ways in which to storytell here really bothered me, because I think there could have been other opportunities to really present these characters. I actually really I love shows like Legion and shows that examine the idea of atypical presentations as potential superhero identities in these fictional universes, like potentially taking what our society considers deficits and subverting that to like, no, these are superpowers, or these are just atypical presentations that we haven't really fully understood. I really love that subversion, but this is disappointing. This is just a disappointing way to examine those topics. And I totally agree, Arkeida. Like, I wouldn't sit down and watch Split again, because it's like really, really graphic and upsetting at times. And I would say that of all three, Unbreakable might be like the most compelling as a story.
It's so funny because a lot of people think Unbreakable is very boring.
Oh,
Jenny raised her hand. I personally think Unbreakable is really compelling. But I guess because it's kind of unusual. But yeah, but like we were saying in the Into the Spider-Verse episode, that all superheroes need therapy.
Yes. Definitely.
So like if it had not been such a incorrect take on therapy, it would be really nice to see more, just like more of that intersection.
Right, like in Iron Man 3, I guess.
Yes.
Which is a whole other discussion on itself.
Yeah, really great portrayal of PTSD. And just as a side note, the therapist in Split who ends up dying, I think she was a good-natured, well-intentioned practitioner. But why are you going, like, why would you go into his dungeon or his so-called, like, the home that he lives in? Like, that's just not smart.
No. Going back to the series as a whole, I personally, if it didn't feel honestly like a superhero, because obviously I'm used to the MCU and the DCEU, but also, what is Mr. Glass's superpower exactly?
He's smart.
A lot of people are smart.
Well, I think I took it as, because he sees himself as defective in one way, another part, it's like that thing. It's like, oh, if I lose my hearing, my sight is better. He sees it as, if my body is unable, then my brain makes up for all of that. Therefore, I am intelligent, more so intelligent than
but
the rest of the humans.
I guess the question is, it made me start thinking about what the definition of a superpower was, because there's a lot really extraordinary people out there who can like run really fast, or like geniuses. They can. There's this guy who can eat anything. No one else can do that. He can eat metal. You know what I mean? So it started making me think about who is a superhero exactly. Is the Beast a superhero because he can climb walls and he's super strong?
Honestly, I think he's just strong. I don't think he was actually climbing walls, because when you look at him, he was kind of like breaking it in a little for something to grab.
Exactly.
And I was like, you're not actually scaling this. You're not actually Spider-Man. I'm sorry. You're breaking a wall right now.
But that's what I mean. It's hard for me to see it necessarily as a superhero film, like trilogy, personally.
What constitutes superhuman or supernatural abilities?
That is the question.
Yes.
That is the question. Answer it. I don't know the answer.
I don't have the answers.
It's not.
Sorry.
It's not that what I see in the trilogy, in my opinion, but that's just me.
Maybe maybe Shyamalan had intended for us to be this uncertain and to kind of wrestle with that ambiguity to make it a little bit more realistic, or to make it kind of stick with us a little bit. Even from Unbreakable, from the first movie, I think we have moments of doubting whether Bruce Willis has superpowers. Like, he could just be a really strong dude, or maybe he's super resilient. The kid was even sort of like, by the way, I hated that scene where the kid was just adding weight to Bruce Willis.
First of all, how strong is this kid to be picking up these weights too? And I'm like,
I also didn't feel like it was a dramatic enough amount, but to be fair, I don't lift weights, so...
Yeah, I lift 12-pound weights. No, I don't even think, it's like 8-pound weights at the gym. Like, oh, little baby kettlebell. I'm like, this kid is tinier than me and lifting these like giant plates. And I'm like, no.
So even there I felt like maybe we're meant to believe that, at least in that moment, that he's potentially very, very strong. But as Jenny's saying, like, this is this superhuman, or is it just an incredible characteristic? There are a lot of people with incredible characteristics that are in the 0.001% of those, in the ways in which they excel. And so I may be giving M. Night Shyamalan some credit here that, I don't know, could be undeserving, but perhaps some of the questioning, some of the uncertainty around the superhero aspect is intentional.
I think it is, which makes it very interesting for sure. But the final scene is a way to kind of solidify, yes, they have superpowers, and yes, everyone should know about it. But someone seeing those, like I mentioned before, someone seeing those videos will be like, eh.
I did not see it. I saw it as if somebody saw these videos and noticed that they had these abnormal abilities, would they feel more compelled to come out? But then, now that we all know that they're dead, would they even want to if there's like this giant conspiracy
oh my god
to kill
yeah.
them? Yeah, I'm sorry, I just answered that myself. I'm like, never mind, I don't want to do that.
Yeah, the reality is not as nice as you would hope.
No.
Yeah.
No.
That's very true. But I don't know. I mean, I will say something I did appreciate about the movie was about Glass was I really loved that they used so many of the same actors and actresses as Unbreakable.
Yeah, it took me a second to realize that kid
in advance,
was.
I just kind of went in cold to the movie, and I was like,
right.
So like his son and Elijah's mother both being the same actors were.
By the way, Elijah's mother looks amazing.
I know.
Yeah.
I was like, huh, wow.
Yeah, and then they also used like deleted scenes. Like that they had filmed at the time of Unbreakable.
Oh,
yeah, that was cool.
Which worked.
Is
so
that the
well.
scene where? Is
like
that
the
scene
father?
Where he walks into his son's bedroom?
Yeah.
Okay. Yeah.
And then
whether...
also I think that the scene where young Elijah was on that, like,
oh my god,
the merry-go-round or whatever. I think that was actually filmed at the time of Unbreakable.
Probably.
That was like pain. That was so painful to watch.
Yeah, I'm sure you were sitting next to me, Jenny. I'm a very animated movie watcher.
I closed my eyes. I couldn't watch it. I wasn't able to watch that scene.
We're like gripping each other, I think.
So, Drea, do you think that, or do we all think that this trilogy is helpful or harmful to the stigmas surrounding mental illness?
Well, like Drea said, it's like a it's a text basically you can read to interpret how mental illness is handled in media and in our society, right? So it's kind of useful in that way, that's the point of critics and reviews and being able to read movies like that. But I don't think it's that good for
that's sophisticated
for mental illness.
Yeah, I think, it helps me because I can give an example of how
that's what I mean,
some films really add elements of horror where they don't exist to the discipline. And when I make this, I sometimes mention this to my husband and he'll remind me, like, most people know that this is meant to be fantastical, it's meant to be horrific, like most people understand that this is not realistic. And while I agree with him, I also just worry that as especially young people, as they develop concepts and perceptions around help seeking and just kind of like mental health exploration, that this is a lot of what they're consuming. And so I do have concerns about that. I wouldn't ever be the kind of person to say, like, this movie shouldn't exist, or like it's so harmful it shouldn't be out there. But I do think that it allows me to embrace other fictional available narratives that either are more realistic or more positive in their portrayal of treatment delivery, mental health provision, and systems that are actually quite helpful and not harmful to individuals who are needing support.
I think that's super well said. Yeah, I mean, do you guys have anything else that you want to say about the trilogy?
No, I don't think so.
Okay. No. Well, this has been super fun. As you know, I'm a self-proclaimed Drea fangirl, so I really enjoyed having you
I am too now. That's why I felt so embarrassed to burp earlier. And you were on.
I totally didn't even hear it.
Okay, that's why I was freaking out.
If ever another movie comes out that you're like, oh my god, I need to talk about this, feel free to reach out and be on again. We like to sometimes give like a podcast or a phone number or a website or something that people can use to give help or to get help if they need to seek treatment or just like for wellness. Do you have anything you would like to share?
A couple of things I just wanted to mention. I have a lot of students who have recommended apps that help them with day-to-day mental health promotion. And I'm not sure if you've talked about this on the show before, but I really support the use of apps to just handle not just like everyday mental health, but also when we're needing emergency self-care, like in the moment, we just have to regulate ourselves and we need to get out of moments where we're triggered or moments where we feel out of control or moments where maybe we're watching Split and we need to take a moment to ourselves and feel a little bit more balanced. So I really support that. A couple that my students have mentioned to me are Dailyo, Headspace, and Worry Watch. And those, I believe they're all 3 of those are free to download, and they allow you to keep record of your mood and anxiety ratings. They allow you to kind of examine your own trends, and they store your data so that you could better understand how your own episodes impact you, and how they maybe form trends so that you can take better care of yourself.
Yeah, we had Rose Delvecchio, who is co-owners of Fan Mail with Jenny, on our second episode, and I believe that she recommended Headspace.
She recommended Dailyo.
Right? Or Dailyo.
No,
okay.
Dailyo. Yeah.
Yeah. And she, her day job is as a mental health educator. So,
yeah. Director of wellness or something. Yeah.
Yeah. So that's 2 essentially wellness educators telling you to download this app, guys.
Yep.
So I think if you don't have it, it's time. It's free, so
yeah, definitely.
Yeah.
I did also want to add on to that. I know I had spoke briefly about my PTSD early in this episode, but for anybody that does live in the New York City area and is also experiencing PTSD or sexual violence or any kind of trauma, you can also reach out to Safe Horizon. That is who I went through for my PTSD counseling, and they are free, and they do provide counseling and help with all of that. And you can go to their website at safehorizon.com, and they also provide a lot of other information on how you can seek help for that as well.
Is that in person or online?
It's in person.
Okay, thank you.
Yes, that's only for the New York City metro area, for those that are listening in New York City.
Yeah, but I wonder if they might have resources for other cities.
I think they might. I am not certain of that, but
yeah, check them out.
So thanks so much for listening. If you like what you hear, subscribe, review, and rate us on our social medias.
Yep, they are Fandom and Wellness on Instagram,
Fandom and Wellness on Facebook,
and Fandom Wellness on Twitter.
Come hang out with us online. We also have a Patreon now, which you can find at patreon.com/Fandom and Wellness.
As a patron, you'll get access to behind-the-scenes content, deleted audio from episodes, full interviews that we've done, and other stuff that Jenny feels like posting, because Jenny edits everything because she's our oracle.
Yep.
Yes. And your support means that we can continue to improve the podcast. So become a patron at patreon.com/Fandom and Wellness.
And remember, be kind and take no shit.